what sort of relationship can a physician build in the context of telehealth?
Well, that's the question we asked in the paper that we're talking about here. And the paper started with us saying, well, with these younger students challenging us older physicians and saying, well, you can invest in relationship in different kinds of visits. And we said, okay, well, let's develop a list of kinds of visits, and let's take one end where everybody would agree that you really want that continuity relationship, someone who's known you over time. And at that extreme, we really had the example of kind of an end of life kind of situation where you've got a lot going on, both medically and socially, and the family needs to be convened, and it's complex, and really being known as a person in the context of your family and your community and your life course is important. So there's one extreme where no one had any doubt that this continuity would be important. And then we came up with other kinds of visits, and then we said, let's take the other extreme. The other extreme that we came up with was a one-off telehealth visit. I mean, you can have a telehealth visit with your regular doctor, and actually in the COVID era, that's happening a lot more. But let's just look at this extreme example of where you've just plunked down your credit card, you just need a commodity of care, you've called in, and how could you invest in relationship there? So that's the thought experiment that we did. And we just started making a list of the things that you could do. And then we compared that list to some of these other kinds, and a lot of the things were the same. So even by doing that telehealth visit, you're showing some respect for a person, which is a good start to a relationship. The person saying, I just need some convenient care. I don't actually want to drive someplace or take a bus someplace. I just want to look on my phone or my screen on my computer. Well, you're making that available to me. And then once you're there, you can do things to try to tailor the care a little bit. You can certainly show your face. And if the person wants to show their face or not, you can give them that choice. You can start with where they are. You can maybe ask a question about who they are as a person, rather than just getting right down to, what's your complaint, and let's get you a treatment. Let's both get on with our lives. And you can sense maybe that's what they want. Maybe they just do want that quick thing. And if you sense that, then you do that. But if you sense that they would like to be known as a person a little bit more, you can ask them a little bit about that. Try to figure out how this symptom they're having or diagnosis you're making fits into their life and what's important in their life. So there's just lots of things that we do in continuity over care. We do a few of these things over time, and that builds the relationship.